emergency room and is hospitalized in the closed ward of the hospital. So the patient is approximately 40 years old. He lives with his family, he's not married, he's unemployed. And he comes to the emergency room accompanied by his family because in the last week he started to act in a weird way. He was restless, stopped sleeping, stopped washing, stopped eating, and started to talk in a disorganized manner, jumping from one concept to another, and saying sentences that insinuate that he was followed by aliens who want to kill him, and he needs to protect himself, and he became very tense and wanted to attack anyone he suspected that is persecuting him. And the family members already know the patient, and they know that when this kind of behavior begins, then it means that the patient is going to deteriorate, so immediately they take him to the emergency room. If we go to the psychiatric history, this patient has like 10 hospitalizations in the past. The first hospitalization was when he was 18 years old, and it was an acute psychotic state. He had delusions of persecution and violent activity, and was at a high risk to endanger himself and others. And he is, since then, he has been hospitalized many times, each time for the same clinical picture, more or less. And in between these hospitalizations, there was an increased deficiency syndrome, negative symptoms. He would be dysfunctional, he lost his motivation, he had a flat affect, he had reduced thought process, he would speak rarely, and he would not be able to take care of himself, and he actually needed the support of the family all time around. So this would be the descriptive diagnosis, where you have psychotic episodes and deficiency periods and oscillating between psychotic activity and negative symptoms, schizophrenia. This would be the descriptive diagnosis. Now, when we come to translate this to brain-related diagnosis, we actually know one thing for sure from the literature, that psychosis is related to a disconnection syndrome in the cortex. So the cortex, the brain, acts as a system, organized system, and in cases of psychosis there is a breakdown of this organization, there is a breakdown of connectivity, and different regions in the brain and systems in the brain act statistically independent. So then you get this disorganized, fragmented activity of the brain, like the auditory cortex could act independently of the rest of the brain, and you get the sensation, emergent properties of hallucinations, auditory hallucinations. And when different systems that represent concepts act statistically independent, jumping from one concept to another, then you have this loosening of associations with disorganized speech and problems of combined logic, generating erroneous thoughts about the environment. That would be the delusions. So a disconnection dynamics could be a good brain-related formulation. So it is a location in the body, that would be the cortex, and what happened to it, that would be the disconnection. And actually we can go further, and we can even say that the organization of the brain is a small world network organization, and in this case we have a disturbance for the small world network organization, but we won't go into that. It's a long, complicated explanation for now, but we'll take it further and say that negative symptoms would be probably related to overconnectivity in the brain, where the system is locked, it's freezed, it's like a crystal, and it is limited in the dynamics. And that would explain the reduced activity, reduced thought process and speech, and the insufficiency of the brain to act for higher mental functions, motivations, and so on. So now we can envision schizophrenia over time as oscillating between disconnection and overconnection dynamics. And each time the brain tries to correct to get an optimal higher level connectivity dynamics, but it fails to do that and starts with a disconnection collapse, and then trying to correct, go into an overconnectivity dynamics. And these two dynamics oscillate over time, giving explanation to the phenomenological aspects of schizophrenia. So this is what I want to emphasize. We can take phenomenology like positive negative symptoms in schizophrenia and retranslate them into a brain-related dynamics, which would be etiology. Like you say, mitral valve prolapse, a location in the body, what happened to it? It's not functioning. Or appendicitis, a location in the body, the intestine, and it is infected. And also in psychiatry, the brain cortical dynamics, which is fragmented or overconnected. Lastly, to have more specific location of the activity in the brain, we can target executive central networks, which are related to consciousness and act in the millisecond range of activity of the brain. And so now we are more pinpointed. We have a place in the body that would be the executive network. We have a disturbance of dynamics that would be a disconnection or overconnection in the small world network organization. And this way we have the map to try and think of how to correct and cure schizophrenia. We actually need to re-optimize brain activity and find the neuromodulation aspects that can control the executive network, re-optimizing its activity into a brain-related optimal activity which eliminates the symptoms of schizophrenia.